Metro Atlantans have been stuck with big emergency room bills, even though they have insurance. Channel 2's Dave Huddleston investigates a new policy that some say kind of expects patients to just diagnose themselves. Dave?
Yeah, Jovita, Blue Cross Blue Shield of Georgia put the new emergency room policy in place last summer. And under it, Blue Cross will not pay for ER visits it finds inappropriate.
I had a dull aching constantly, and then I had really sharp stabbing pain that came with these waves of nausea.
Brittany Cloyd went to the emergency room at this hospital in Frankfort, Kentucky last summer, thinking she might have appendicitis. ER doctors ran multiple costly tests, including a CT scan and 2 ultrasounds. The diagnosis, pelvic pain.
The ER doctor had said that my ovaries were riddled with cysts.
A few weeks later, Cloyd got a surprise in the mail, a bill for more than $12,000. Her insurance company, Anthem, had denied her claim.
And so I was very mad because I think we pay over $400 a month for insurance, and to pay that much and to know that they're not going to cover something is absolutely ridiculous.
Cloyd is not alone. Piedmont Healthcare told us it has documentation of Blue Cross Blue Shield of Georgia, a subsidiary of Anthem, denying ER claims for about 75 people treated in its ERs. We checked with Georgia's insurance commissioner and learned 6 complaints have come in about the policy.
I understand the idea of controlling costs, but we think this is the wrong approach because it's really putting patients in jeopardy.
The president-elect of the American College of Emergency Physicians told us his group has heard from thousands of patients who've had their claims denied in the 6 states where Anthem has enacted the policy.
It appears to us that they are looking only at codes, diagnosis codes, rather than at the medical record itself.
Anthem sent us a statement that reads in part, Anthem's avoidable ER program aims to reduce the trend in recent years of inappropriate use of ERs for non-emergencies, as the cost of treating non-emergency ailments in the ER has an impact on the cost of health care.
It's easy to somewhat Monday morning quarterback the provider when the entire documentation of the encounter is there.
We asked healthcare consultant Max Rybold what the solution is.
I think, frankly, and this may not be a very good answer, the 3 working together in concert.
That's insurance company, healthcare provider, and patient. The American College of Emergency Physicians has met with state and federal lawmakers and Anthem to talk about the policy. But
I can tell you that we are exploring all options to reverse this policy.
When you say all options, are you considering a lawsuit?
All options.
Does that mean a lawsuit?
All options.
Piedmont took that step, filing a lawsuit against Anthem, accusing it of a national scheme to save money at the expense of patient safety. But Piedmont dismissed the lawsuit as part of a new contract with Anthem Blue Cross Blue Shield of Georgia. As for Cloyd, she appealed that $12,000 bill twice before finally getting this letter stating Anthem would pay up. But she says she never wants to go through this again.
That's terrifying to know that they have so much control over me as a company, to put this fear in me that I'm not going to go back to the emergency room.
Dave's here now. So what can patients do when they've had their ER claims denied?
Well, medical consultant Matt Rybold told us they can file an appeal with their insurance company like Cloyd did. They can also hire a lawyer, ask their employer to get involved, and file a complaint with the state insurance commissioner.
So all those steps just to make sure you're treated fairly. Thank you, Dave.